Bristol Health, we're in. I'm sorry, I apologize. I'm Kurt Barwis. I'm the president and CEO of Bristol Health. And I can assure you this morning, as everybody came through the door, no one was shaking hands. There was no hugs or kisses or anything like that, which is something that we should all be observing, at least 5 feet distance, unless you have to do otherwise. One of the things that I would say personally is, as I've watched over the weekend the news, the press conferences around the state, and the cooperation and the collaboration between all of the state providers, is just that. There's a tremendous amount of cooperation and across everyone. The Hospital Association, all the hospitals in the state are working together with the Department of Public Health, the local Department of Public Health, the DPH, on many initiatives to help really contain and address this situation. Most importantly, I'd like to thank the governor's office and Governor Lamont for his efforts as I've watched him really engage and his administration engage. I know from meetings that I was in last week late, advocating for another test kit for the state of Connecticut, which I understand we now have, which is excellent. Thank you very much for that. And as you can see from the folks that are standing up here, Senator Blumenthal, I was a part of a discussion with the American Hospital Association and the CDC last week, and I know that our congressional leadership has worked hard to make sure that we get the right financial support and initiatives in place. So without further ado, I'd like to introduce Governor Lamont. Thank you.
Thank you. Thank you, Kurt. Good morning, everybody. And as Kurt says, we are working together at the federal level, at the state level. Josh is helping to take the lead, along with Renee Coleman-Mitchell, our head of Commissioner of Public Health, working with the professionals here at the hospitals, as well as our local health community. And we're trying to make this seamless and give a coordinated message in terms of what our priorities are. And Kurt, you reminded me, and the mayor reminded me on the way here that next year is the 100th anniversary of Bristol Hospital. And Roger Newell gave the land, I think, 100 years ago for this hospital. And he gave the land because he was inspired, a little scared by what had happened that a couple years earlier with what they called the Spanish flu. And our local hospital system back then in 1918 was overwhelmed. And even the Congregational Church here, the parish hall, was loaded with patients. And that was the inspiration behind Bristol Hospital close to 100 years ago. And I just think you should know that today, 100 years later, Connecticut has one of the best hospital systems in the world. Nobody can be totally prepared for a virus like COVID-19, a virus that's changing every day, and the infections are accelerating every day. But we are working together on a collaborative basis to do everything we can. I'll tell you that, working with Josh, we have notified all of our state employees right now, no travel out of state, not necessary. Anybody thinking about coming into state, contractors or otherwise, try and do that by teleconference. Try and do that by telephone. Let's limit what our exposure is. Marco Jakian, overseeing our universities, same message to those students. No need to go home over spring vacation. And if you do go home over spring vacation, you may ask you to self-quarantine, self-monitor for 14 days on your way back. An ounce of prevention. I think we're trying to get ahead of this. We've looked what happened in Seattle. We see the accelerating infections in, just in Westchester County, right nearby, southern Connecticut. And infections know no state boundaries. We're being very careful in terms of our state employees as well. Look, you don't need big meetings with, 100, 200 people. I know we got a bit of a crowd here. Please sit one seat away from each other. But this is important. And we're telling sort of our older state employees, bring your laptops, stay at home maybe as needed for the foreseeable future. Those of you who may be older or maybe have some respiratory issues or other things that could put you at risk. And this is a message that we're taking to private employers around the state as well, trying to lead by example and make sure we coordinate. Over the last week, as you know, we've not only met with all of the hospitals, we have phone call today again with superintendents of schools, following up with all the mayors, met with the legislative leadership or talked to the legislative leadership just yesterday in terms of a coordinated response, what they should be thinking about in terms of the legislature and big public meetings. And we'll be following up on that as well. Kurt mentioned the testing and the fact that we do have another test kit. That represents the ability to do another 600 tests. You know, we've done less than 50. All that means to say is we are prepared. You know, we've obviously had our first Connecticut case of COVID-19, and it will not be the last. Kurt was telling me about the trailers that have been on order here. So over the next week or so, let's hope that they'll be able to do some preliminary testing right here at the hospital. People, you know, only come if you have a physician's order. Only come if your doctor says this is something you probably ought to check out. Then you go into that first trailer, they'll check out, see whether you ought to have that test. We have that test. Take it up to the state lab and make sure you'll know within 24 hours what your status is. I'll just leave you with the fact that I've said everywhere I go, hope for the best and plan for the worst. And that's what we're doing. You know, I think from a collaboration point of view, I'm talking to my fellow governors. We had the Surgeon General, federal government, come and make sure that what we do is give people a consistent message. Be careful, use obvious prudence, and we're going to get through this in the near term, staying together as a state. Thank you, everybody. Senator Blumenthal.
Thank you. Let me first thank Governor Lamont for his very calm, vigilant, and vigorous action in response to this crisis. He has demonstrated the courage to face facts and reality and talk about it clearly and candidly. I wish the same could be said of our president. Deception and denial are not a strategy. What we've seen at the federal level is too much lowballing and bungling. I am glad that finally we have another diagnostic test here in Connecticut that will permit expanding the amount of testing. It is too little and very late, inexcusably late. These kits were promised last week to me personally and other senators by the Vice President, still unprovided, even though they were promised. And this one kit is simply the beginning of what needs to be done for testing. To put it very simply, we cannot know the rate or the root of infection without prompt and thorough testing. You can't know without testing. You can't combat this disease if you don't know its extent. I want to thank the hospitals for their professional excellence. We ought to be very proud of our hospitals here in Connecticut. They've stepped up. They've said cost is not a consideration, but they should be reimbursed for all of these costs because we know the hospitals are hard-pressed as it is. I want to thank the docs and the staffs and volunteers and board members of this hospital and all around the state of Connecticut and local health directors and officials who are here today. Thank you, Mayor, for your excellent work at a local level. And we ought to be very proud of our mayors around the state because they've stepped up too. The resources now are there at the federal level, $8.3 billion, championed on a bipartisan basis. The votes were overwhelming. Only one vote against in the Senate. Unprecedented in recent history for a major measure. So reimbursement for Bristol Hospital will be forthcoming from the federal government, reimbursement to local and state health directors and their departments, as well as aid for the development of a vaccine, new therapeutics, new diagnostics, and the CDC and NIH. We need to avoid cutting their budgets as the Trump administration has proposed. And let me just conclude on this note. We are facing a threatened economic whirlwind. We need to aid businesses, especially small businesses, as they face possible sick leave on the part of their employees. And no question, employees who are sick should avoid coming to work Among the precautions suggested by the governor, all of them excellent. Let me add this one. If you're sick, stay away from work. If you're an employer with a sick worker, encourage them to stay away from work. All they can do is infect others and cause even more workers to be ill. And the federal government must provide assistance for sick leave. It should be paid sick leave, but small businesses should not be asked to shoulder the burden without aid from the federal government. That's our next challenge. There's already in the $8.3 billion supplemental, $1 billion in small business loan subsidies to help them weather this storm. But we are truly facing an economic whirlwind without White House leadership capable and credible and experienced in the way that's necessary. So I will be returning to Washington in just a couple of hours. I'll be urging that the president enlist a new economic team with battle-tested and crisis-respected members who can help direct what the economic response should be. And probably we'll need a federal stimulus plan, including aid to small businesses and bigger employers as well. But I've talked to now hospitals. We've been all around the state. We were in Bridgeport on Saturday. I've been in Hartford, Milford, New London. The common theme is we need the resources. Small businesses are going to be hard-pressed. They need to be helped as well. Thank you. And I'm to be followed by Dr. Andrew Lim, Director of Emergency Medicine at Bristol Health. Thank you, Dr. Lim.
Thank you, Senator. Good morning. I wanted to give a brief update about our efforts locally here at Bristol Hospital. We have been meeting on a daily basis for the last few weeks, really coming up with plans with the overarching goal of, A, how do we care for our patients safely? How do we protect our staff? How do we protect our patients? And how do we create an environment knowing that there can be a potential surge in patients where we can continue to care for those patients? We are working on and have come up with many protocols about how to safely screen for patients as they present to the ER, because really the quick identification of those who may become a person under investigation is really critical in terms of determining who may have coronavirus and making sure that they don't expose others. We've been working with staff in terms of making sure that they know how to appropriately use their PPE or their personal protective equipment so they can care for a patient in a safe manner. We're also working on kind of some unique emergency department protocols where we can separate out those who may have the illness and separate them out from the general population in terms of working on obtaining more negative pressure rooms and setting those up, but also some unique things in terms of a front-end triage process. We've actually ordered multiple mobile units with the idea that a primary care physician can perform a phone screening and identify those who would be appropriate for testing. A patient can come to the hospital to have those swabs performed without entering the building, and they can leave as well, similar to many of the outpatient tests that we currently perform. In a similar fashion, the front-end process allows a clinician to identify who may need to be tested, and those patients can be tested in that kind of separate environment. But with the added utility of utilizing technology such as telemedicine to allow that patient to be evaluated by a physician or a physician's assistant without unnecessarily exposing them to risk. So in summary, I just wanted to give you an idea of all the efforts that are occurring behind the scenes at the hospital on a regular basis. We're working with many of the older local hospitals and really taking our guidance from the CDC, from the World Health Organization, from our infectious disease specialists, and really bringing together the directors of every department to make sure that everyone is safe during this time. Thank you.
Dr. Lim, thank you very much. In closing, just a couple remarks. The thing that's amazing that I see in this state and that really makes a difference is the way people collaborate. I could tell you 24 hours a day, our team, the team at the Connecticut Hospital Association, the city, the mayor's office, whenever something arises, whenever somebody thinks of an opportunity to improve on our protocols, there's just an incredible amount of interaction, communication, and support. We have the Department of Public Health here today to actually look at the mobile units and help us accelerate the process. As you can imagine, to put 4 mobile units anywhere requires heat, light, power, and approvals. And what I could tell you is the process that we're going through to actually establish those mobile units is just incredibly fast. In normal terms, it might take, maybe a couple months to do something like that to get everything approved. But it's that kind of collaboration that makes all the difference and is going to really keep people in the state of Connecticut safe. So, Governor, thank you so much for being here. And I'm sorry, I'm closing remarks. I forgot my health department director, Matt.
Thank you. Hi, good morning. My name is Marco Palmieri. I'm the Director of Health for the Bristol Burlington Health District, your local governmental public health agency. I'm tasked with the responsibility to assure and assist our public health infrastructure, including Bristol Health, to assure that all residents will be properly cared for any public health threat, including coronavirus. Public health agencies such as the Bristol Burlington Health District throughout Connecticut and United States have a responsibility to plan and prepare for any public health emergency that exists. And we have to utilize our community partners, both federal, state, and local, such as Bristol Health, our boards of ed, our first responders, and everyone in our community to do their job and to be responsible to protect each other. We all know the message, folks. The message is we need to do our part as a community to protect our communities. So remember, although this is a new virus, the coronavirus is new, the public health message is old. We need to avoid coming to work if you're ill. We need to take those personal precautions that we've all known about with regards to influenza. We're dealing with a serious influenza issue here throughout the United States. If we just follow those same rules and protocols and measures individually, we can do our job as a community. This is really important that we're here at Bristol Health because they have been a leader, I can assure you. Without their strong leadership and partnership, Bristol and Burlington would not be properly protected. So I really want to make sure that everyone understands that the community as a whole here, Bristol Health, their first responders, their EMS, have been an amazing partner in protecting the public. So I'm proud to be the Director of Health for the Bristol Burlington Health District, and I want to assure you that we're going to be prepared, as we have been for the last 20 years. Thank you very much.
Thank you, Marco. I apologize for missing you. Are there any questions as we go to closing?
I had a question.
Yes.
I get this from a lot of people who are, very concerned and panicked that people are being treated, and it is treatable. I mean, there are cases right in hospitals all across the country, and some people are struggling and dying. But can you comment on that? That people, is it a 2-week period? I mean, with proper treatment and early, do people recover and get better?
Great question. I'm going to let Dr. Lim take care of that.
So I know initially the mortality rates were reported to be about 2%. I think there's some emerging data to suggest that the mortality rate will be closer to the flu, so less than 1%. We know that approximately 80% of people don't require any medical treatment. So much like the common cold where there's no treatment, a lot of the things that you can do are homeopathic, staying hydrated, getting plenty of rest, and staying away from others. Some people with coronavirus do get sicker, and that's what we're preparing for. Much of the treatment is supportive. So some of that is the unknown. There is no antiviral, there is no vaccine, but I know there are a lot of smart people working on developing both those things.
The other question I had is a lot of employers now are requiring their employees, wherever they've been, not to that a good plan, and should other employers or even the state take a look at that?
Do you want to handle this, Marco? Or? Yeah.
So the CDC guidelines right now are that if you're returning from a level 3 country, as defined by the CDC, so currently that's China, South Korea, Iran, Italy. Am I forgetting anyone? I think that's it. We're encouraging people. The CDC is guiding, and we've encouraged state employees and encouraged private employers to have those people go straight home, self-quarantine for 14 days, ensure that they're well before they come back to work. So that's the approach we laid out actually middle of last week for the state, consistent with CDC guidelines.
Does the state travel ban apply to collegiate games?
Higher educational institutions, both UConn and the Board of Regents, are going to be making their own decisions on those topics. We've been in touch with the leadership of both of those entities, and they are, as the governor mentioned, President Ojakian issued similar guidelines, but they will have an exception process to evaluate things like athletics and so forth for how they're going to handle travel.
Josh, do you or the governor have any update on the 3 patients identified over the weekend?
We do not. No updates there.
What
Governor,
considerations
can I
go
ask
into
whether the insurance commissioner has not waived the testing fee for state insurance plans yet? Are you going to encourage him to do that?
Well, I can tell you the major health insurance providers have waived the copay, waived the deductible, so there will not be any cost for anybody so carried there. We're doing the same for Medicaid. Maybe you'd like to add to that?
What considerations go into declaring a state of emergency, and is that something that the governor is considering?
I'll start. Everything we've laid out today we can do without a state of emergency. And that was the most important thing, so we get in front of this. Preparedness is so key. We haven't ruled anything out going forward, though.
I also had a question about the Wilton case. I know you said there was no update, but people want to know, did this person have children in the school system? Is that something that can be answered?
Do you know that?
There are strict rules and statutes around confidentiality. There's HIPAA considerations, so we're guided to be very careful in terms of what we disclose, so we're not able to disclose that information. What you can be assured of, though, is that the public health community is tracing the contacts that these people have had, and those people are being followed up with to ensure appropriate measures are taken, even though we can't talk about the specifics of those people publicly.
Will the
Can you give us an idea of how many
forth,
contacts?
No, we can't.
will the state put forth guidelines for nursing homes since that's a vulnerable population?
Yes, so actually, I think it's either yesterday or this morning, our Department of Public Health has provided guidelines to nursing homes recommending, or directing actually, that they limit visitors to no more than 2 per person. We understand that there may be additional guidance coming from the CDC potentially as soon as today with regards to long-term care facilities and making sure that we're restricting access appropriately. We're taking similar steps at some of our other state facilities, such as Connecticut Valley Hospital and Whiting, for example, to make sure that we're being very careful about the traffic coming into our facilities.
Are those guidelines posted online anywhere?
I'll check on that for you. I believe they are.
What efforts is the state making to get information out to members of the community, hard of hearing and deaf, the blind, visually impaired? What sort of efforts are you making to get the word out to them besides having an interpreter stand next to you during these news conferences?
Sure. So a couple things. One is we announced, days are blending together a little bit here, but I think either Friday or Saturday we announced that 211 is now enabled for information related to COVID-19. And as you know, there's texting service associated with that as well, and it's multilingual and so forth. So we are taking steps to ensure that everyone that needs access to information can get it.
And has there been some sort of directive issue? The governor spoke earlier about state employees, no travel. You mentioned being sick, stay at home. So, I mean, have you actually issued some sort of written guidelines to
Yes.
state agencies?
So we sent a letter to all executive branch employees this morning. It's on the governor's Twitter feed, I believe. You can see it there. Governor outlined many of the actions. Another one that we have a major focus on right now is large events. So we specified in that letter that any events that are being hosted or organized by a state agency that are anticipated to have more than 100 attendees at them, we're going to be looking at those events and most likely either shifting them to a teleconference or potentially postponing them We're encouraging other large employers and organizations to evaluate similar opportunities. These are very important steps that we can take now. Even while we only have one case here in the state of Connecticut, we are watching very carefully what's been happening overseas in Italy and China. We're looking at what's happening on the West Coast of the United States, and we're taking aggressive action now to get out in front of this to ensure that we delay the spread and give the great healthcare providers that we have in the state the opportunity to deal with the patient flow as it comes.
Just one more question. What guidance is being offered to assisted living communities? Obviously, folks are free to come and go from those residences as anybody else.
Yep. So similar to the earlier question, our Department of Public Health is working with those facilities with specific guidance. The CDC is putting out, I think Friday, put out some additional guidance about precautions that can be taken. So there's contact being made with all providers of services to, across the board in Connecticut, healthcare providers, other assisted living, nursing homes, et cetera.
And the CDC guidelines, by the way, on travel are likely to be changed even as early as today. There's been an outbreak, as you know, in Saudi Arabia. So travel from that country as a result of the pilgrimages or other travel made to Iran may, as a result, be restricted. And I might just add on the issue of travel, the airlines still have failed to clarify that people's fares will be refunded for canceled or changed flight plans, which is a major disincentive for some of them to do the right thing. So we're going to continue pressing. I did a letter. So far, the airlines haven't responded. A letter that really urges them to clarify the dates and also the refund policies that will be in effect.
One of the issues about this that concern people is the sense of uncertainty about what comes next. And I don't know, maybe this would be for Josh, but does the state have a plan in place as to what's the trigger point for example, a public school to be closed or a public school system to be closed? Do you guys know at this point, is it a single case that would, in a single school, that would require that school to close, a system to close, and so forth? Yeah, so as you can anticipate, Mark, there are a nearly infinite number of scenarios you could imagine where a student, a relative of that student, a teacher, associates that they've had contact with. And so what happens is when there's a question about these issues currently, the school districts are calling into the Department of Public Health. We're consulting with the CDC if necessary on what the appropriate steps are. Prior to any declaration of public health emergency, those decisions ultimately are the decisions of the local school districts of actions that they want to take. I think everyone saw, it was last week or the week before, there was a couple of schools in Rhode Island that had some scares, closed down temporarily, reopened in one case. So you'll see a similar set of reactions in Connecticut as cases occur that have school relations to them. And then on the broader question you're asking about, what would trigger a broader response, a declaration of a public health emergency, clearly that is much further down the road and something that we very much want to avoid. The consequences and the costs of closing a school are significant in terms of the follow-on impact in the community to parents that can't go to work. Many of our children in our schools rely on the meals that they get in school to be able to be fed every day. And so that really becomes a last resort, which is why we're taking a lot of these other actions now on more discretionary large meetings, other things that we can do to reduce the risk of transmission before we have to get to thinking about larger scale actions with regards to schools. What are the powers that a declaration of public health emergency that would then go to the governor and the commissioner that they do not have now?
There's a long legal answer to this, Paz, that I think if it's okay, we could get you in touch with Bob Clark or something if you're interested.
Are there more people waiting to get tested than there are kits available to test them in the state currently?
So the state lab up until this point has been prioritizing our testing capacity for patients that have been admitted at our acute care hospitals so that healthcare providers can make timely decisions about how to potentially isolate those patients if necessary. As was referenced earlier, in the last couple of days, so Friday, Quest Labs announced that they are online with a commercial test, and today LabCorp is active with a commercial test as well. And the plan will be for the alternate collection sites, as was discussed earlier, with the trailers here. There's another facility that's going to be going live at Greenwich Hospital either today or tomorrow, actually. Those tests will get shipped out to those commercial providers for processing, given that the people, by definition, who are providing those samples are not critically ill. They're coming in, they're walking in, they're giving swabs, they're being sent home, as opposed to we want to prioritize the state capacity at the state lab. We are not constrained at the state lab to deal with the tests associated with admitted patients at our acute care hospitals.
Senator Blumenthal, can you, I wanted to wait to the end, because obviously the health is more of a concern, but the Congress's reaction to what's happening with the stock market, and is there concern over that on a national level that's also causing a lot of panic?
There's a need for crisis-tested but calm, steady, strong leadership, which so far we are not seeing from the White House. And I've talked to a number of my colleagues, even before the latest plummet in the stock market today, about the need to come together on a bipartisan basis, just as we did on the health package, to address the economic challenges ahead. We're in the calm before the economic storm that's threatening. And it will be as potentially devastating to many people as the health crisis, because job losses are possibly looming. We need to act before that crisis is upon us. The federal government failed to act before the health crisis came. We need to do better on the economic front. And just as a number of options, a federal fiscal stimulus plan, including aid to small businesses for their paid sick leave policies. And yes, we need to encourage workers to stay home if they have come from countries where there is a hot spot, but not without pay. And the burden should be borne by the federal government, just as it does in unemployment compensation. We don't ask employers to bear that full burden, just as we don't ask workers to bear it. So my hope is we will come together on a major, massive scale, just as we did on the $8.3 billion supplemental, to provide aid to our small and larger businesses. And just as an example of the national security interests involved, as you may know, assembly production has been shut down on the F-35 in Japan and Italy, so that Lockheed Martin, which is the contractor using Pratt & Whitney engines, has stopped the assembly lines in those countries. That's just one example of how our national security can be affected if our small and medium-sized businesses in the supply chain, we're talking about the supply chain, are affected. Likewise, pharmaceutical drugs. A lot of the active ingredients that go into pharmaceutical drugs made here are actually manufactured abroad in places where supply lines have been shut down, in China, for example. So the reverberation, the ripple effects can be very widespread, and I'm hoping we will come together, rise above the partisan din, as we did in the $8.3 billion supplemental, come together on a bipartisan basis. And that goes as well for the insurance issue as well. Consumers, very simply, should not be paying co-pays or deductibles to get these tests. They ought to be waived, and the disincentive to their getting the test should be removed.
Even without accounting for the second test kit that just came in, Connecticut had only used about 10% of its testing capacity. Why are those numbers so low, and do you expect to see the testing numbers ramp up over the next few days?
Yeah, it's back on the prioritization that I described earlier from our public health department, making sure that the testing capacity of the lab, both in terms of the kits or the reagents that are used to process these tests, as well as the staff, is able to be prioritized around the highest need cases. And so that's what we've been doing to this point. with the tremendous leadership of Bristol Hospital, Greenwich Hospital, and others who are bringing online these additional alternate testing facilities, and the commercial partners who are going to be processing those tests, you'll be seeing the testing volume shoot up very rapidly beginning this week.
And is that because the number, like the type of people will be expanded who are tested?
We will on a case-by-case basis, depending on what the need is. Let me just say in conclusion, to Sue Raff's question about the potential economic risk that Dick detailed, we're as ready as we can be. We have a bigger rainy day fund per capita than any other state in the country. A lot of people had their eye on that fund. That's going to help us weather what could be an economic storm. Right now we have what's the potential for a public health contagion. And I think you see with the folks here from Bristol Health, I think you see in terms of what Josh and what we're doing in our Commissioner of Public Health, working with the locals, working with the feds, we have as good a coordinated response as we can. We're lining up more testing capacity depending on what the need may be. Look, you can't prepare for what you don't know, but we're as prepared as we can be. Thank you, everybody.
A large segment of the population that is hourly workers, they cannot work from home. That's not an option for them. They don't have paid time off. What assistance will be available for those workers?
So I think we could take those questions offline if that's okay. I think we need to wrap this up, and
You've got an opportunity here. It's a good question about to what extent the state through the DOL and employers are equipped to deal with hourly workers who don't have service workers who don't have the option.
Well, not just service workers, manufacturers, because the paid sick leave law specifically exempts manufacturer workers, such as the Pratt & Whitney workers and members in the supply chain.
Yeah, there's work going on this topic within the state of Connecticut with our Department of Social Services, Department of Labor colleagues looking at this issue. Senator Blumenthal mentioned discussions at the federal level about additional assistance that may be available. We are well aware. We want to make sure that we have the supports in place so that people who are living paycheck to paycheck, who are sick or have a sick loved one that they need to care from, are not faced with that choice. We understand the criticality of that issue, and we're working on it very hard. I would also just underscore, if there was ever an argument why paid family medical leave is an important thing in this country, this is a great case as well.
But I think it's important.
Have the authority to tell insurers to waive co-pays on testing and other related things?
We're going to have an announcement on that later today.
Thank you.
But I think it's important to recognize Connecticut has a law that is better for workers than most other states, even with its shortcomings, as are illustrated in this instance. Connecticut is better prepared. Connecticut is at the forefront of hospital care and health care. But this virus has no respect for state borders, and the economic reverberations will spread nationally. We are an interconnected economy, and so the fiscal stimulus that's necessary to keep our economy going is essential for Connecticut at the national level. It can't be done state by state. And as good as Connecticut is, stronger than most other states, we need the national and federal government to step in as well.
So, folks, thank you very much. There's a lot of resources out there. Personally, I was on the CDC website this morning. I think you should use that as a resource. I also happened to see the governor's message to his department heads this morning and read that, and I think that's excellent guidance that you put out. I appreciate that. It actually helped us internalize what we were going to do. Thank you all for coming, and be safe. No shaking hands, no hugging and kissing. Wash your hands, 5 feet. Take care, folks. Thank you.